Yes, I want to thank the organizing committee that has selected our work to present it today at the 7th edition of webinar of Cancer Research and Therapy. I present to you our studies with the title Evaluation of the Nursing Care Model to Improve the Quality of Care for Patients with Breast Cancer. We have no conflicts of interest to disclose. The research has been funded by the Department of Health of the Generalitat of Catalonia through a scholarship, and we are grateful for our permission to use the Ipswitch patient questionnaire from the researchers who developed it, Mr. Robert Ely from the University of Queensland and their colleagues. The background. Several international guidelines include the breast care nurse or BCN as essential part of multidisciplinary team of breast cancer. Published standards on the BCN are not uniform, but some core competencies emerge from a review of the international guidelines, such as USOMA in Europe and ABPC in the USA, or Cancer Australia from the Australian government. According to different international guidelines, the core competencies for breast cancer nurse are holistic needs assessment, health education and information, emotional support, decision-making support, support to families and caregivers, care coordination and continuity, consultation with other health professionals when needed, and presence during different phases of breast cancer care, diagnosis, treatment, and follow-up. The outcomes of a literature review carried out by our team were the following. Patients greatly value these nurses who provide information and support. BCN improves patients and multidisciplinary teams' experiences. Patients' needs are better met and they feel more satisfied with their care. Care continuity also improves, which probably exerts a positive influence on clinical outcomes. However, more studies investigating the relationships between the BCN and survival are needed. Our breast unit is made up of professionals from two institutions, the Catalan Institute of Oncology, a monographic cancer center, and the Belvitge University Hospital, a tertiary level hospital in its territory in Catalonia, in Spain. The professionals in our breast unit include breast cancer doctors and advanced practice nurses specialized in breast cancer. The nurse has been part of the team for more than 20 years. Our breast care nurse model, according to the visits we make to patients, all patients diagnosed with breast cancer are visited by the breast care nurse. The first BCN visit is made after the case is presented to the tumor committee and before the start of treatment. Visits scheduled by BCN are in surgery treatment, few days before the surgery date and after the surgery in order to heal the surgical wounds, minimum 2 visits. In chemotherapy treatment, face-to-face visits at the start of treatment or when there is a change in a scheme or drug, and telephone visit between 2 and 3 days after starting a new treatment or drug. In hormonotherapy treatment, visit before the start of this treatment. For radiotherapy, treatment is another team of nurses who take care of these patients during this treatment. At the end of all treatment, the breast care nurse makes a final visit 2 or 3 months and after. And the nurse visit on demand. The patient can call the nurse's phone directly to report a problem, request a visit, or advance a scheduled visit. And our model, according to the functions and competencies that we develop regarding the role of care, comprehensive needs assessment, provide emotional support to patients and caregivers, and provide health education, information, and advice. And regarding the role of case management, coordination of care, ensure continuity of care, and consult other professionals. The breast care nurse is present at different times of diagnosis and treatment. And the purpose of these studies is to evaluate the nursing model of our breast cancer unit and the European Society of Breast Cancer Specialists is a European organization that defines the care of organizational requirements necessary to guarantee the quality of care offered in breast center or units, and thus improve survival rates. EUSOMA defines the requirements of each of the professionals that make up the breast units of their certification. For the BCN, EUSOMA indicates direct patient care, management of the care process, and consider it as part of the central team of the breast unit. EUSOMA defines quality indicators related to the patient's access to the nurse, as well as the activities to be carried out. Therefore, one of the ways to evaluate the nursing model of a breast unit is to evaluate the correlation of the interventions of the BCN with the quality indicators published by EUSOMA, for which carried out a study for this purpose. Another way to know the impact for our nursing model is to know the opinion of patients about the level of response of the BCN to their needs. And we also carried out a study with this objective. Today, we want to present the results of these both studies. The methods of the first study, which assess the correlation of the BCN interventions with the quality indicators published by EUSOMA. The study design is observational, longitudinal, and retrospective. The study sample consisted of all patients diagnosed with breast cancer for the first time or as a relapse, local or distant, for 1 year, July 2016 to June 2017. The follow-up time of the patients was the entire primary treatment in patients with early disease and 1 year for patients with advanced disease. The study variables were sociodemographic data, clinical, pathological, and treatment data, and data on nursing intervention recommended by international guidelines. The data were extracted from the medical story. The results of this first study, I present a summary of the sociodemographic data. The sample volume was 382 patients. Of these, 325 had early disease and 57 had metastatic disease. Only 3 patients were men. The mean age of the sample was 58 years, with a range between 25 and 89 years. 49% did not work, and 62% lived with their partner or with their partner and children. 5% acknowledged having financial difficulties, and 7% lack of social support. And these are the clinical and treatment data. At the time of diagnosis, 14% were stage 0, 30% were stage 1, 30% were stage 2, 11% were stage 3, and 15% were stage 4. 4% were diagnosed with advanced disease on the time of disease onset, and 100% of the patients with early disease received surgical treatment, on which 70% the surgery was conservative. 85% underwent axillary surgery, 47% received chemotherapy, almost 80% received radiotherapy, 77% of the patients were treated with hormonotherapy. And the nurse intervention data. The data have been separated according to whether the patient has early or advanced stage disease in order to appreciate the differences detected in these groups of patients. Our breast unit incorporated the figure of the nurse in the year 1995. There are currently three full-time nurses. The unit visits about 400 early breast cancer patients and about 375 patients with metastatic disease each year. 100% of patients with early disease have contact with the nurse during primary treatment, but only 58% of patients with advanced disease. Patients with early disease attend the visit with the unit nurse at the end of the treatment, although 30% do not attend the visits. This visit, especially older women who depend on their relatives to go to the hospital. Everyone has the contact telephone number of their nurse in case they need it. In reference to the days that elapse from when the cancer is diagnosed until the nurse makes her first visit to the patients, there is an average of 25 days. The nurses participate in the elaboration of the unit's healthcare protocol, in the elaboration of the unit's healthcare circuits, in the elaboration of the clinical pathways and procedures, in the documents that are delivered to the patients, and they also participate in the meetings of the team for continuous improvement. Nurses conduct their own research. The nurse documents all her activity in the patient's medical records. The BCN attend the unit's tumor committee weekly. This nurse assesses the emotional distress of the patients and her family at different times of the illness and offers emotional support. Also participates weekly in the psychosocial committee, together with psycho-oncologists, psychiatrists, and social workers, and to comment on the most complex cases and refers to the patients to these professionals when necessary. The geriatric evaluation is shared between the breast care nurse and the medical oncologist. Patients with advanced disease are referred to the palliative care unit yearly and are cared for in parallel by both teams, the medical oncologist and the breast care nurse, and the palliative care team. Counseling on health lifestyle is important throughout the illness, including the end of treatment. The nurse highlights the importance of sustained physical exercise, which can influence recovery from the adverse effects of treatment, improve mood, or reduce the risk of recurrence, among other benefits. And we are going to the second study, the methods of second study that tries to know the opinion of patients about the level of response of BCN's care to their needs. The study is descriptive, a cross-sectional study. The sample, systematic sample of patients with non-metastatic breast cancer who finish their primary treatment in our breast unit more than 3 years before, between the years 2017 and 2018, during a year, were 301 patients. The study variables, sociodemographic, clinical pathology, treatment, and nursing interventions were extracted from the clinical record. The opinion of patients about the level of response of nursing care to patients' needs from the Ipswitch patient questionnaire sent to patients and received by email. The Ipswitch patient questionnaire offers 15 questions about the interaction of the nurse with the patient. The questions were grouped with categories of contact, access, coordinating care, information needs, psychosocial support, emotional support, and practical support. The questionnaire was translated and adapted to our context and reviewed by experienced patients as a pretest. The letters include a study information sheet, an informed consent to return signed if they accept to participate, the anonymous questionnaire, and a pre-stamped envelope with the address of the research team. The results of this second study. On the first shipment, 116 patients completed the questionnaire. It was decided to send a second shipment to the 185 patients who had not completed the questionnaire. 23 patients completed the questionnaire in this occasion, and 301 patients were offered to participate. And finally, 139, was 46.2%, complete the Ipswitch patient questionnaire. Here we see the most prevalent sociodemographic characteristics and the patient studied. And here we can see the clinical characteristics of the patient studied. And I will highlight that when the surgery is mastectomy or extensive surgery in oncoplasty or reconstruction is almost always offered in the same surgical act. We perform neoadjuvant chemotherapy on many occasions, and most patients receive radiation therapy and or monotherapy. This slide presents the results of patient responses to the Ipswitch patient questionnaire. Most of the patients are satisfied with the information they received from the breast care nurse to understand the clinical information, the organization of the health team, understand the disease, the treatment, the recommended self-care, know the expected adverse effects and how to act if they appear, However, we also see opinions about insufficient information about the possibility to choosing treatments or knowing support services. In this slide, we see that most of the patients believe that the information and support from the nurse help them to feel better, to be able to understand and express their emotions, to communicate with the team, to understand and cope with adverse effects. But there are also opinions about the lack of spiritual support and or being able to talk about alternative therapies, as well as the lack of help to cope with family problems that arise because of the disease. And the conclusions of the studies. Of first study, the first of the studies shows a high concordance of the nursing model of breast care evaluated with the requirements demanded by EUSOMA for the accreditation of the quality of care for the breast care nurse. But it has made it possible to detect a gap in the follow-up of patients with advanced disease carried out by this nurse. A different approach is required for patients with advanced disease, with care that is not as closely related to treatment and possibly more related to emerging needs. This point requires more studies to know the follow-up that most benefits this group of patients. In addition, the first contact between the nurse and the patient must take place before the first week after the diagnosis of breast cancer, in accordance with international guidelines and the literature that analyzes this topic, which shows the improvement that this entails, above all, in the support that the nurse provides in this initial moment. The conclusion of the second study shows the opinion of the patients about the breast care nurse. This nurse responds mainly to their needs for information and support. They value that the nurse helps to understand the health environment, to understand what cancer is, how it is treated, what side effects or complications may appear, what to do if these side effects appear, how to take care of yourself to feel better. The nurse facilitates the expression of emotions and offers support when difficulties arise. However, there are also opinions about unmet needs, such as dealing more deeply with spiritual needs, being able to talk about complementary treatments, or giving patients the opportunity to make decisions about their own treatment more often. The breast care nurse needs to know the information and support needs of her patients, as well as their values and preferences. In this way, it is possible to carry out an effective and quality holistic and individualized approach for each of them. Patients highly value the role of the breast care nurse. As international guidelines already recommend, all breast cancer patients should have access to a breast care nurse through the course of the disease.